My name is Eric Sorenson, and I chose to do my parasitology interview assignment on parasites in San Diego County. As I was unable to secure an interview with a local infectious disease specialist as planned, I did have a great option of contacting Dr. David Ward, someone I know from San Diego who is a two-time Physician of the Year at the University of California, San Diego Medical School, and is a nephrologist who does a lot of work on blood parasites. Dr. Ward uses apheresis as a treatment for blood and kidney disease and infection, including parasitemia in severe cases. As a former and potentially future resident of San Diego County, I was able to discuss this thoroughly and come up with new predictions based on what I know about the environment in San Diego. It is on the border with Baja California, Mexico. Many parasites more typical of developing countries are encountered here due to proximity to Tijuana and a large workforce that moves back and forth across the border daily. It's a subtropical climate, so you're at a latitude that certainly does favor a wider variety of parasites. As we've seen in this class, there are a lot of parasites that only live in warmer climes closer to the equator in the tropics. There's also a huge military presence and a port. They bring in all kinds of exotic parasitic infections that are also treated by physicians in the area, including Dr. Ward. My personal predictions before talking to Dr. Ward included considering that the most common helminth would be a roundworm like Toxocara canis. I thought this might be more prevalent, especially with all the dogs that don't get shots and get dewormed that possibly migrate over from Mexico. And certainly in a big city like that, there are a lot of stray dogs as well, and cats, as far as Toxocara cati. Other prevalent species I thought could include Enterobius vermicularis, which is well known to be the most common human parasite in the U.S. and no different in San Diego. I thought also at that latitude hookworms could be potentially something that would be seen commonly by a physician. And of course arthropods, just like everywhere else, there are some arthropods there. The cat flea is very common in Southern California, whereas we do not have those here in Central Oregon. When I spoke to Dr. Ward, he was impressed with my predictions, but he had to add that swimmer's itch caused by Schistosomatidae in Mission Bay, which is a brackish bay, man-made, used to be marshes, and is commonly used for water sports, rowing, swimming, by a lot of the population of San Diego. And apparently that is a very common source of a number of illnesses, just dermatitis from the schistosomes in Mission Bay, and I had not thought of that. He did agree with me that toxocariasis from Toxocara canis was common, and he thought that would be one of the top three potentially, and enterobiasis caused by Enterobius vermicularis, which I also predicted. So he was impressed with my choices, and although there are no statistics definitely listing human infections and rating them, these were all good guesses according to Dr. Ward. As we saw, the trematode life cycle is complex with an intermediate host of the mollusks, snails. These are common in Mission Bay. It is slightly salty and does have tidal influence, but it's fresh water enough that that these parasites can live there. They don't commonly live in the marine environment. And ducks are another intermediate or definitive, the normal definitive host, but humans can become a dead-end host, just causing dermatitis, although they're not internally infected, fortunately. Toxocariasis is a common illness in San Diego, as many dogs and cats in the area do not have veterinary care and are born and live with these parasites, and they are commonly passed on to humans, especially children who play in the dirt and are exposed to pet and stray feces in the soil. These feces are released in the soil, and the eggs develop to the J3 stage, and then they can infect either rodents that would then continue the life cycle back to dogs or cats, or they could infect an incidental host as a human, which is a dead-end host, and light loads of parasites would not cause illness, as we have learned in class, but heavy loads can cause a number of symptoms, including visceral larval migrans. Diagnosis and treatment. Control could include anti-helminthic treatment, deworming of dogs. Diagnosis, in humans, if it's a subclinical infection, it often does not go diagnosed at all, although checking antibody assays has shown that up to 15% of humans in the United States have antibodies to Toxocara canis, so subclinical infections are quite common. Visceral larva migrans is a sure thing for seeking out further diagnosis via fecal smears of dogs in the house, and treatment differs between dogs. Pyrantel single dose anti-helminthic treatment, common for dogs. In humans, albendazole or mebendazole, along with a course of anti-inflammatories, is the common treatment. Dr. Ward was anxious to move on and discuss some of the work that he does in his field, which is actually very interesting for this class as well, including malaria caused by Plasmodium parasites. This is not endemic to San Diego, but with the jet set and military presence in San Diego, there are lots and lots of cases that show up at his door, as well as babesiosis, which we have studied as well, caused by a tick vector, most commonly in the northeastern United States. And both of these diseases are treated at times by apheresis, which is what Dr. Ward is a world expert in. Malaria, as we have learned, is an extremely common and devastating disease worldwide. And a lot of these military folks come back, and if they have not taken their malaria prophylaxis, they can come home very ill. And there are ways to tell what kind of malaria happens to be infecting the people that show up at Dr. Ward's door. And he was excited to tell me about a case where he had a patient arrive that had glomerulonephritis but not hematuria, and he was able to point out that that was Plasmodium malariae and not Plasmodium falciparum based on those symptoms. Apheresis is used for a treatment. Generally, it has been in the past, when parasite loads in the blood are high. As we know, the Plasmodium parasites infiltrate the red blood cells of their hosts, human hosts, and this can become a very heavy blood infection, at which time removing the red blood cells and replacing them with transfused uninfected cells can be part of the treatment to ease the burden of parasitism in the blood of the host. Dr. Ward discussed how this apheresis works. You remove the blood elements and separate them via centrifuge. It's a complex, dynamic way of doing it, and then you can replace certain elements of the blood, be it the plasma, be it the red blood cells or proteins, based on what's needed to treat the patient. And there is a current controversy going on based on whether or not this is the right way to treat severe malaria cases. There was some work done by the CDC, as I will present on the following slide. In late 2013, the CDC, without sufficient peer review, finished a study and changed their recommendations to remove apheresis as a treatment, which got a lot of people in David's field upset, and he sent me some information, including the articles and point and counterpoint between the CDC and the apheresis experts, discussing who was right and who was wrong, and it seems like it is an ongoing controversy that was very interesting to hear about. Here are some of the counterpoints by the Apheresis Society, discussing the lack of peer review and other faults with the CDC's methodology. And the CDC's counterpoint to those people who criticize their methodology was to, according to Dr. Ward, take kind of a low blow at the apheresis world, which was obviously not appreciated. So it's interesting to hear from the inside how sometimes the CDC and physicians in certain fields may be clashing, may have conflicts of interest. Obviously significant bias may exist on either side. And it was certainly interesting for me to hear Dr. Ward talk about this and to learn a little bit about that. It sounds like essentially the CDC did not want to be questioned on its methods and did indeed take a low blow, suggesting that they revise their apheresis folks revise their recommendation to Category 4 disorders in which the published evidence demonstrates or suggests apheresis to be ineffective or harmful. So that's considered below the belt by the apheresis folks, who certainly do know what they're doing to treat a lot of things beyond malaria. This includes babesiosis, which we have also learned about. This very interesting but less well-known parasitic infection does include an interesting life cycle with both a rodent and tick vector in its normal life cycle, and it can also infect humans and other mammals, of course, and can be passed on through transfusion, as the testing of transfusion blood for the babesiosis infection is inadequate at this time. And there have been actually 150 documented cases of the passing of babesiosis this way in the United States. As noted here, these cases are considered to be a fraction of the true incidence of this sometimes asymptomatic infection. This often occurs in the northeastern United States, although there are several species of this parasite that exist in the U.S., including one that exists in California and Washington, and one would have to expect that Oregon would be a target as well if this tick can exist in those places. We have all the same conditions here in Oregon and expect to see it in the future. When symptoms do get severe, they're very similar to malaria, with malaise, fatigue, fever, as well as renal failure, which is where often Dr. Ward comes in and needs to do apheresis treatment to filter out the blood and lower the parasite load, which can be brought down up to 80% and basically relieve all symptoms in conjunction with other therapies. This can be very effective to give these folks relief. In conclusion, it was excellent to speak to Dr. Ward about the parasitic infections that he deals with in San Diego, as they are quite exotic in general compared to Central Oregon. The proximity to Mexico, large urban population, and all of the influx of exotic pests and parasites makes for an interesting practice. Toxocariasis and enterobiasis, those are common, and then cutaneous infections from swimmer's itch and cat fleas are also common. Common strategies to prevent zoonoses here in Oregon, they apply in San Diego and they apply all over the world, really. Humans are everywhere, and parasites are adapted well to infect us wherever we are, accidentally or purposely. Physicians face enormous challenges in trying to diagnose and treat these diseases caused by exotic parasites, particularly in border towns and port cities. Patients presenting with mysterious symptoms should put up the hackles of any physician, and they should take a thorough patient history and ask them about recent travel abroad or elsewhere, unusual foods, exposure to water sources, and this is a great first step to successful diagnosis and prevention of serious disease via parasitic infections in humans.